then in terms of common complications that you see, what types of things do people need to watch out for?
Yeah, probably the most serious one. Unfortunately, it's not very common, but usually it's not a very painful procedure. And so pain in the first few days, extreme pain in the first few days is a sign that something's not right. One of the things we look out for is called hematoma or blood collection. So, especially with the ear, the cartilage blood supplies from the skin. And, when we do this, depending on the technique we use, when you do the surgery, oftentimes you lift the skin off the cartilage. And so there's always potential blood can form in that space. And if it's not addressed, then sometimes the cartilage could potentially die, which is what happens in things like, cauliflower ears you'll see in wrestlers and things like that if they're not addressed. Infection certainly can happen early on. Keloids, occasionally can pop up. Sutures sometimes can form little granulomas or extrude. Late complications that we'll sometimes see, loss of correction, as you kind of already talked about, over time, things can sometimes kind of protrude back out.
Yeah.
Sometimes patients will get either paresthesias, like little numbness or kind of shooting pain near the incision, or even sometimes some hypersensitivity to cold. Fortunately, almost all those things are pretty rare. We don't see them very often. And a lot of those things, as long as we catch them early, even with hematomas and things like that, they're treatable and usually don't affect the final result as long as they're addressed properly.
Yeah, got it. Yeah, I mean, I've been doing more of these in my practice, and the textbook teachings are that if you have the pain, you have to bring them right back and look at it.
Right.
And I've had that a couple of times now where, patient's been complaining of pain. It seems like it's asymmetric, so I bring them in and it's fine.
Yeah.
So, I mean, I think in the first few days, there's definitely, some degree of discomfort. So, I don't know, like the textbook, what they tell us to like be on the lookout for. I've just found that a lot of patients have some pain, and it's not always the same from side to side. So.
What I found to be helpful is I usually put a head dressing on, almost like a master dressing afterwards, and I always have them come back to the office the next day to remove it in my office. So that way I'm going to see them anyway on post-op day one. If there's anything like a hematoma, usually it's going to pop up in the first 24 hours or so, unless they hit their ear or something. And so you can see it, you can address it. It can happen later on, but it's not as likely. So usually if you're going to see them the next day, you're going to check it, make sure, and if everything looks good, then, the chance of them having something else pop up is relatively small.
Yeah, that's a great way to do things. I usually do it within like the first 48 hours as well. Another little trick I picked up at a meeting was that if you leave the posterior incision, I mean, if you're doing this procedure with incisions, you can leave it partially open to basically just allow it to drain. I mean, the incision will still heal fine, and you just, some of that blood can escape. So no, that's all great material.